Okay, we will go ahead and get started for today. Again, topic of interest is lower body injury prevention, specifically more for the female athlete. A little bit about me if you don't know who I am currently a physical therapist here with Kinetic Sports Medicine and Performance, and also the coach of Black Lax, the 2027 national team. I had 5 years under my belt at Marquette as a lacrosse student athlete there. And then while I was there, I did get my bachelor's of science in exercise physiology and then my doctor of physical therapy from there as well. Have coached lacrosse since freshman year of high school and just really have been loving being able to share the next generation of players, things that I've seen, ways that I've learned, and then now being able to put that a little bit more of that like physical therapist twist into my coaching as well. So again, topic of conversation tonight is the importance of injury prevention and where we can utilize this, especially as we're going into more of the winter months, currently November, so how can we use December, January, February before we begin the high school season and how that can play into the sport of lacrosse in general? So again, injuries are bound to happen. Some can't be prevented, but some can. Again, doing everything that we can in our power to hopefully strengthen, make sure we have enough symmetry between sides. That'll be all stuff that we get into. But those are all things that we're looking at as physical therapists and even the coaching side, how much injuries take away from players' development, the recruiting process. That'll be all stuff that we get into. Of course, injuries lead to time out of those practices, re-injury risk, and long-term issues, again, if those aren't handled properly and as soon as we can address them. Not only does injury prevention help in terms of injuries directly, but also enhances the performance of the athlete, being more symmetrical between sides, being able to be explosive in a safe way. All of those components that we'll talk about will also increase the athlete's confidence in their body and just knowing what it can do and knowing that it's been prepped for practice, prep for tournaments, prep for games. Those are all things that we're looking at in terms of injury prevention. Again, does more than just the injury itself, but also digging into a little bit more of that performance side as well. So I personally have an experience with ACL, meniscus, and an MCL tear that happened my junior year at Marquette Valentine's Day, which is funny enough, but that happened again my junior year. And so you can see the calendar here of how my process, how my timeline ended up happening. Again, with more ligaments, more meniscus issues, that does lead to a little bit longer of a rehab process for myself. Again, a couple bumps along the way in terms of swelling, range of motion, those are all things that I struggled with being non-weight bearing in the crutches, having the straight leg brace, locked in extension. A little bit slower personally progress for myself. Again, each athlete is different, but you can see the progression there of running into the late summer, early fall, integration into practice, starting non-contact, then into contact, into the late fall, and then first game back was nearly 11 months later, especially with ACLs. Again, we looked to that 9 to 12 month timeline. Again, I was on that later and probably was still doing, again, a lot of that strength work, a lot of that quad control, all of that stuff as we got into season as well. It didn't just stop once the games began. So again, a little bit more of my like complicated history, but just wanted to share again my process. I know what it's like to have this unfortunate injury. I know plenty of girls that I've coached, plenty of my teammates can have a whole list of girls who I've unfortunately known who have been affected by this. But again, if I can help one person prevent this injury, then I've done a good job. So hopefully allowing girls to prevent, again, this from happening as best as we can. So a little bit more about the ACL itself. It's again, it happens to, again, many people, professional athletes. Again, as we say, the ACL does not discriminate. It can happen to anybody, any gender. Again, the female is a little bit more commonly seen compared to males, especially in the teenage years. This is when and early in development is when this can definitely happen as we are growing more. But the ACL, the reason why it's most commonly injured is the main stabilizer of the knee. Again, with any contact change or non-contact change of direction is when it can be injured. Again, like a plant and twist. Anytime we're having that femur and that tibia, that ACL is that main connection point between the two. And again, is utilized a lot with any of those cutting, jumping, and pivoting motions. So, like I alluded to, there are many risk factors, especially being a female and being young are two of the main ones that we see and why I wanted to, again, discuss this with my, again, female players that I see a lot. Again, we have how teenagers are vulnerable to growth. A lot of people are going right into, okay, this lacrosse is my main sport, starting in like eighth grade, or lacrosse is my main sport, starting my freshman year. Again, the more that we specify into one sport, we're lacking components of other sport. And again, having many of those components can just be allow the athlete to be more well-rounded, and they're seeing a lot of those different movement patterns. Not seeing the same ones repetitively can lead to, again, a little bit more of those risk factors that we see for not only ACL, but other injuries as well if they're not getting other stimulus to, again, their body. Fatigue as well can also be a factor, right? Especially for these long tournaments that we usually see on the weekends, getting into that second day of girls complaining of pain, fatigue, that can also definitely be a factor. In terms of some of the PT risk factors that we see, weak hip, quad, poor landing mechanics, those can all be things that we can sort out on the PT end. Again, you don't have to just go to physical therapy if you are in pain. You can also go to physical therapy to get some of these asymmetries looked at, being able to see, okay, are we moving the most efficiently? What does the force plate data say? Again, there's a lot that we can do on our preventative pre pain side as well to be able to help patients not only if they're in pain, but also prevent these injuries based on some of the asymmetries that we're seeing between hips, quads, and hamstrings as well. So my personal risk factors, I had a kind of a left knee tweak in high school. I didn't go to PT. I went to get it checked out, but nothing really came of it. Sat out for practice maybe for a week or so, but didn't really do anything to address that. Very interesting that then a couple years down the road, I end up tearing my ACL on that same side. So again, that was a while ago. Could I still have had deficits from then? Definitely. We see patients all the time who maybe had something in high school or a couple of years down the road where then they're still dealing with issues from that occurrence. Also, fatigue was a factor for me as well. We had just played our first game of the season a couple days before this one. Was that too much too soon? We're at a away game. Was it like a different condition? Not familiar with the environment. Also, that is something to think about. And then likely again with many patients that we see who do end up having ACL tears or just general pain or general asymmetries, right? Having the quad hamstring asymmetry or between sides as well is also a possibility. Like I alluded to before, ACL injury, you're out for nearly a year of doing your sport. There's financial surgery cost of that, PT cost with that. Can we use those costs on the front end to prevent this injury from even happening emotionally, right? You're out of athletes out of their sport for a year. They're learning how to walk again. They're learning how to run again. They're seeing their teammates out there being able to do things that they could have done like weeks ago. So there's definitely ways that the athlete can emotionally get discouraged. Again, that's the probably worst part of the process going through it myself is just knowing that, okay, I could playing lacrosse was like the easiest thing for me. And now it's one of the harder things to get back to. Again, with any injury that we have, there's an increased likelihood of that happening in the future, as well as making sure that on the front end, squaring away all of our ducks in a row to make sure that, okay, this is the least likelihood of this being a possibility. So again, many effects of ACL injury, but definitely again on the coaching side as well, seeing girls lacking time in front of college coaches if that's something they want to pursue, lacking that development. Their teammates who are the same age, very competitive. We now take a kind of like a backseat to that progress that we can make on the field as well. Next, again, I mentioned not only ACL tears are what we can prevent. Again, a lot of muscle strains, ankle sprains, shin splints, and then tendinopathies are also what we see as well. Again, there's a way for us to test all of these possibilities, be able to see, okay, do we have asymmetries? What are our movement patterns like? Again, mostly these are the ones that I've seen patients complain of for the lacrosse players that I have seen. And we treat each of these, again, very differently based on what the individual, what the player, what the athlete has been complaining of. And then again, risk factors we slightly alluded to previously. The main one that we do see is muscle weakness or imbalance. So we have a lot of relationships between all the muscles on the hips, quads, hamstrings, again, for some of the ankle muscles as well. If a patient has a specific problem with, okay, I keep getting shin splints or I keep rolling my ankle, those are things that we can look at as well. But usually, again, that muscle weakness is very common either between left and right side, or that ratio between hamstrings and quads, for example. We do want quads to be about, for the testing that we do, about 100% of the patient's body weight. So if they weigh 100 pounds, we would expect them to kick 100 pounds of their body weight. If they do the hamstring testing as well, we would expect it to be 60 to 80% of what their quad can do. So again, we have these general guidelines and numbers that we'd like patients to achieve. If they're shy of those numbers, we can say that they are at a more increased risk of injury. Also, like I talked about previously, poor movement mechanics, right? How well are we able to coordinate the trunk and the pelvis on the knee and the ankle, right? It's one big chain from hips down and hips up, right? So what are we seeing at one joint? Maybe we're seeing the knee caving in. That's due to hip weakness. Maybe we're seeing like the pelvis a little unstable with stepping up, stepping down, things like that. Okay, what are our hip asymmetries like that can lead us to these poor movement patterns? Again, lack of flexibility and mobility. Again, if we don't have that proper range of motion in the joint, the muscles aren't going to be able to effectively work as well, making sure that we're not ignoring those things, but also addressing those if there's, again, a difference between side to side or the ratios that we're expecting there as well. Again, these other two ones, hopefully, are a little bit more controllable in terms of load that we're seeing, warm ups as well, not warming up properly. Again, we have that specific warm up that we would like to do for lacrosse players, making sure we're getting all of those movement patterns, seeing them in the first time during the warm up rather than having the first time being in the game. Again, fatigue and overtraining, that can be, again, a big factor, especially for these tournaments. What are the girls doing? If they had two tournaments or three games or two games on that Saturday, what are they doing then to prepare for Sunday, right? Those are things that I hear as a coach is girls are sore, they're tired on Sunday. And then I ask them, did you do anything like stretching, mobility, anything to help with that? And usually the answer is no. So that means that there's even a way for us to improve, even if we are on the road at these tournaments, being a little bit more diligent with what we are doing at the hotel specifically as well. And then these are all things that I alluded to previously in terms of like risk factors. Now, what can we do in terms of the PT side, how we can help with this injury prevention? That's so important. So, in terms of strength, again, if we have those strong muscles, we are helping support our joints, right? Anytime we're running, cutting, jumping, if we don't have the muscles to help absorb that force, it's just going to go straight through those bones and those joints. So again, the stronger muscles that we have, the more muscle we have to be able to support our joints, we have a much less likelihood of having, again, pain, discomfort in those, again, main joint areas. Again, I just discussed the importance of hip and core stability in terms of the pelvis. Again, what are we saying there? How does that impact the knee or the foot down the chain? Or how does the foot impact up the chain as well? We're not only looking at, oh, my knee hurts. Okay, what's directly at the knee? Or my hip hurts. Okay, what are the muscles exactly at the hip? We're looking at those different areas to try to see, okay, where are we having the cause of the pain is not necessarily always the source of the pain. And then again, like I've discussed, symmetry between sides. And then movement mechanics as well, proper landing techniques on their jumps. We have force plates to be able to assess, okay, how is the athlete jumping? What do we have to then focus our exercise prescription on? Cutting and changing direction. Again, lacrosse is a very quick and fast sport. We are changing direction nearly every second, right? Especially when we're dodging, when we're having to mark a player, when we're trying to go grab a ground ball, avoiding players, right? That is what we classically do 99% of the lacrosse game, right? So what if we break those movement patterns down, what are we saying? How can we make those more efficient? And then, like I mentioned, avoiding that knee valgus collapse, that's a very common position that, again, female athletes find themselves in. Again, it's not a bad thing to be in. How can we control that position with, again, breaking down some of those movement patterns and what we are seeing there? Again, flexibility and mobility, being able to, again, look up and down the chain, not just at one of those joints, having those stretching guidelines. I want to be dynamic before activity, a little bit more static afterwards. And then what are the athletes doing once they get to the hotel room? Are they foam rolling? Are they doing any sort of like massage to themselves? How can we really figure that out in terms of making sure they're fresh for the next day competition? And then in terms of lastly, plyometrics and agility, this sometimes gets ignored in the terms of injury prevention, strength training in general, is if girls go to the gym on their own, a lot of them miss out on this ability for them to control their body in those more like running agility ways. Again, ties into that change of direction as well. What plyometrics do they have in their plan? How does that impact their ability to then go on the field? It's knowing where their body is in space, it's being able to be quick and efficient with their movements, and using that strength that hopefully we're building up to allow for that speed and that stability combined. Again, like it says here, emphasis on the quality of the movement, not just the quantity. And then I know we discussed this as well in terms of recovery and load management, but these are all things that we should think about not only at the tournament, but also in general, right? Especially in high school season, there's a lot more volume and a lot more load more consistently over time, right? We're having practice every single day, games thrown in there, usually one pure rest day a week. That's something that we want to be able to manage with all these other factors, right? Sleep, nutrition, hydration, recovery. These ones are often overlooked. Again, many of the sleep rules, waking up and going to bed at the same time, aiming for 8+ hours a night. That sleep time allows our body to recover rather than with a lack of sleep, right? We're not giving the body the time it really needs to, okay, take that reset, take that time off our feet, and really hopefully get us going for the next day. Nutrition, again, 3 times a day. Again, as athletes, especially as with tournaments, making sure we're eating enough. We're running out there all day long. We want to make sure that we're refueling our body, giving the nutrients that it needs to be able to execute the the sport essentially. Again, hydration, this can be a lot missed within these winter months, right? We're not sweating, don't feel like we're sweating as much. We don't feel as hot, but it's equally as important that we're still hydrating. Again, anytime that we are playing, practicing strength training, again, recovery, like we talked about. And this isn't just pure like off days. Yes, those are important, but what are we doing to give our body like those feel good days, right? Are we foam rolling, yoga, mobility, right? Those are all that kind of like active recovery that we want to move our body compared to just the passive recovery that can be the kind of Normatex, commonly ice baths, stuff like that. What are we doing to move our body? Hopefully make it feel a little bit better. Again, that like motion is lotion, like they say. Doesn't always have to be strength plyo based. Again, we want to add in those recovery days as well. So this is just a brief week layout of what the winter season prep should look like for you guys as you head into your high school season. Again, we're wrapping up the fall season. Again, there's some open gyms that I have in here as well. But again, it's the prep and like the off time that's going to set you up for success by the time that your high school season comes. So if you've been dealing with something for the past couple weeks, if you just ignore that, don't do anything about it, and then now, bam, you're into a lot of practices every single day. Games start relatively soon in the season, right? If you ignore everything that you've been dealing with, it's not unfortunately just going to go away. It will show itself if we haven't done anything to take care of your body, prep for it. Again, we have 4 years in high school to be able to leave our mark, play well, do what we can. Any couple of those games that we're out are going to be really important, especially once the club season comes around in the summer for recruiting, for player development, right? Really making sure we have all of our ducks in a row before we really start to hit the high school season hard and then the spring or summer club season once that comes around. So this is a week layout roughly. Again, what we would expect to see and would want to see to hopefully have an injury prevention squared away. So again, lacrosse skills 1 to 2 times a week, open gyms, individual work, private lessons, right? Again, a lot of high schools are having those open gyms, right? Making sure you're going to those or making sure you're doing their individual work or lessons, right? Making sure that we're still having that lacrosse stimulus as we build into the high school season, right? If we just go from not doing any lacrosse into a ton of lacrosse, that introduces your body to a lot of change. And our bodies are pretty picky on what we like and what we can tolerate, right? So if you've been doing your open gyms throughout the week, you've been adding in your strength stuff, right? It shouldn't feel like a big jump when you go to do a lot more lacrosse stuff. Again, that's 5, 6 times a week in the high school season. Again, adding in a little bit more of that like gym workout. Again, having a nice good warm up. Again, the first time that you necessarily do anything in like a strength or plyo or lacrosse session, the first time that you should see that or work on that should be in your warm up. So again, your body shouldn't be surprised. Again, balance and stability drills, jump drills, change of direction, strength movements, and a cool down. That's the order that we want to be able to see, the strength or gym workouts in, right? I'm not only having strength in here. Like I mentioned, we want to make sure we're adding in a little bit more of those plyometrics, the change of direction, and that balance and stability that we need as well, right? If we're just focusing on strength, we're missing a lot of those other risk factors that are commonly shown or seen with patients with any pain or discomfort. So again, we want to make sure we have everything in those gym workouts, not just strength. Lastly, like I talked about in the last slide, having that recovery too is going to be really important in between those gym days, in between those open gyms. Like I said before, it's not just taking off days as much as that is important. We want to make sure that our body is feeling good for the future. Again, that kind of saying that motion is lotion. Again, if we just are feeling sore and tight and don't necessarily do anything about it, it's going to take longer for our body to be able to recover. Again, we're athletes. We really like having that stimulus. We like to be moving. We like to do our sport, do other sports, do a lot of things here and there. But if we're not really taking that recovery time to make sure our body feels good, we're setting ourselves back for the next time that we go to do any certain activity. And then in terms of the special for the Black Ops players like yourself, so we're doing $50 initial evaluations. Again, you do not only have to be in pain to be able to seek out physical therapy. So we do have, again, if you are in pain, great, we can address that. We also do have the injury prevention package that we are running for you guys in terms of receiving all the testing that you see below, hips, hamstring quad, force plate jump testing, movement screens as well. That will be all included with all the evaluations. Again, you could just fall into one bucket of patients in pain, that kind of normal evaluation, or kind of like the more injury prevention side for that as well. And then if you have questions, feel free to reach out to me at hannah@kineticsmp.com. You can call the office or I left my cell number on there as well. Also, we are doing similar workshops, lacrosse specific warm ups, force plate jump tests, injury prevention programming for high schools around the area. So if that would be something that you guys would be interested in, let me know and we can get that set up. If any questions you guys have, feel free to ask away or feel free to again look us up online or feel free to shoot me an email at hannah@kineticsmp.com.